15% of all cancer deaths are from breast cancer, and over 40,000 women this year will die of breast cancer despite billions being spent to try and combat the disease. I want to impact that curve, and I want to do everything that I can to protect the women of this country.
Since I've been 17, I had fibrocystic breasts with many adenomas removed and cysts removed. Over time, they've done different procedures. In the beginning, they would remove anything that was a lump. I've had many incisions from where they would remove the lumps. That was a little bit more painful. That was probably the most painful part of it.
Our McGee Women's Breast Program is the biggest screening breast program in the country and the most forward-thinking. We are offering breast MRI to the largest cohort of women in the state. Several years ago, Pennsylvania passed 2 laws that were very impactful. The first is a supplemental screening law that requires insurance carriers to cover supplemental screening for women, large groups of women. And the second law that was just recently signed indemnifies patients from copays and deductibles for that supplemental screening. So one of the benefits at McGee is we have a multidisciplinary program. So we got together with our genetics and high-risk folks, and we crafted a program that we felt the science supported the supplemental testing, and that's who is included in our program today. Mammography, while being a good test, isn't ideal for a lot of different patients. Patients with more dense breast tissue, people at higher risk.
Breast density is something that's come up quite a bit, particularly with the more recent sort of news and information that became available. That density is related to both increase in risk and perhaps decreased in the usefulness of mammogram.
This is the benefit of supplemental screening MRI. In a woman who has dense breasts, and or family history or personal history of breast cancer, cancers can hide in the breast tissue because they're white. But the MRI allows us to identify it based on the function of the breast, not just on the anatomy of the breast. Tests like MRI can allow us to tell the difference between cancer and not cancer much better than a test like a mammogram that just shows us anatomy.
When I had the sonogram and the mammogram, they recommended that I have the MRI.
She will be receiving our abbreviated study. The abbreviated study is a shortened study. It only takes about 7 or 8 minutes for the patient to be on the MRI scanner for this abbreviated test. That reduces cost for the patient and discomfort for the patient. And it also allows us to image more patients a day, so it opens access for all women to have those abbreviated protocols. MRI is the oldest of the contrast-based studies for the breast, and it is the gold standard of care. It finds the most cancers for women that we screen. Therefore, having a robust screening MRI program is integral to providing quality health to women. The reason that women with dense breasts or otherwise high risk really are the ones who should be receiving this study is that there is a lot of evidence to show that mammography alone is not good enough in these populations.
Breast imaging is a perfect area for identifying the strengths of Gadopiclenol.
Okay, I'm getting ready to start this next set of pictures. It's going to be about 2 minutes and 30 seconds.
The reason we give these gadolinium-based contrast agents in the first place is because of a property known as relaxivity. You can think of it as potency. The higher the relaxivity, the more powerful that drug is in showing us the abnormality we're trying to find. Gadopiclenol by far has the highest relaxivity of any of the contrast agents we have ever used for neuroradiologic imaging.
Okay, I'm going to get ready to give you that contrast now. You might feel a cool feeling when the contrast is going in, okay? Just through that, like where your IV is, that's normal. Other than that, you really should not notice anything different, okay? You have about 2.5 minutes and then you'll be all finished.
In its current indication, the clinical dose of Gadopiclenol is half of what other FDA-approved agents are. So right off the bat, we can cut half of that dose, which is, as you said, very important for these women that have to receive these exams once a year for, potentially the rest of their lives.
Okay, I'm going to start that contrast now. We arrived at her dose by looking at her weight. Her weight was 160. She would get normally 16 of traditional contrast. Today we would have given her 8.
To deliver the same quality images with half of the amount of gadolinium is very important for patients' healthcare.
We've already scanned thousands of women in our abbreviated protocol, and that number is growing at incredible rates. Women want the best, most accurate care that they could possibly achieve. And through these new techniques and modalities, we're able to offer that to our women.
It is very exciting. Anytime we get to do something new and be a leader, it's good for the patient.
I didn't feel anything, actually. They told me I would feel something warm. I didn't feel that. I'm a counter, so you start counting the seconds when they tell you it's 2.5 minutes, and that went really quickly. I didn't realize that you could do it with a dense breast, so I'm happy to have had that done.
This drug provides us with something we've never had the ability to do before. Now, for the first time, we can use even smaller doses. It's a win-win for everyone involved.
We screen over 100,000 women a year. And we have a responsibility to provide our women with the absolute cutting-edge best technology that we've got. And that means finding cancers that are impactful to our women's lives. So searching for new technologies that really finds that accuracy window is what is important to us.
I feel lucky that I was able to have this done. I'll rest easier knowing if there's nothing there, and if there is, it's probably caught early, so I'll sleep easier then.
We're really excited about being in front. We at UPMC very much care about our patients. We are connected to them and we are engaged with them. It is our mission to eradicate breast cancer harms, if we can, in the least invasive and most compassionate way that we possibly can.
Everything evolves for the better in medicine, and this is one of the better things for women with breast issues.
ViewWay, Gadopiclenol solution for injection. Indications. ViewWay injection is indicated in adults and children aged 2 years and older for use with magnetic resonance imaging, MRI, to detect and visualize lesions with abnormal vascularity in the central nervous system, brain, spine, and surrounding tissues, the body, head and neck, thorax, abdomen, pelvis, and musculoskeletal system. Important safety information. Warning: risk associated with intrathecal use and nephrogenic systemic fibrosis. Risk associated with intrathecal use. Intrathecal administration of gadolinium-based contrast agents, GBCAs, can cause serious adverse reactions, including death, coma, encephalopathy, and seizures. ViewWay is not approved for intrathecal use. Nephrogenic systemic fibrosis. Gadolinium-based contrast agents, GBCAs, increase the risk for NSF among patients with impaired elimination of the drugs. Avoid use of GBCAs in these patients unless the diagnostic information is essential and not available with non-contrasted MRI or other modalities. NSF may result in fatal or debilitating fibrosis affecting the skin, muscle, and internal organs. The risk for NSF appears highest among patients with chronic severe kidney disease, GFR of less than 30 milliliters per minute per 1.73 meters squared, or acute kidney injury. Screen patients for acute kidney injury and other conditions that may reduce renal function. For patients at risk for chronically reduced renal function, for example, age of greater than 60 years, hypertension, diabetes, estimate the glomerular filtration rate, GFR, through laboratory testing. For patients at highest risk for NSF, do not exceed the recommended ViewWay dose and allow a sufficient period of time for elimination of the drug from the body prior to any readministration. Contraindications. ViewWay injection is contraindicated in patients with history of hypersensitivity reactions to ViewWay. Warnings and precautions. There are risks associated with intrathecal use of GBCAs that can cause serious adverse reactions, including death, coma, encephalopathy, and seizures. The safety and effectiveness of ViewWay have not been established with intrathecal use, and ViewWay is not approved for intrathecal use. Risk of nephrogenic systemic fibrosis is increased in patients using GBCA agents that have impaired elimination of the drugs, with the highest risk in patients with chronic severe kidney disease as well as patients with acute kidney injury. Avoid use of GBCAs among these patients unless the diagnostic information is essential and not available with non-contrast MRI or other modalities. Hypersensitivity reactions, including serious hypersensitivity reactions, could occur during use or shortly following VUA administration. Assess all patients for any history of a reaction to contrast media, bronchial asthma, and/or allergic disorders. Administer VUA only in situations where trained personnel and therapies are promptly available for the treatment of hypersensitivity reactions. And observe patients for signs and symptoms of hypersensitivity reactions after administration. Gadolinium retention can be for months or years in several organs after administration. The highest concentrations, nanomoles per gram of tissue, have been identified in the bone, followed by other organs: brain, skin, kidney, liver, and spleen. Minimize repetitive GBCA imaging studies, particularly closely spaced studies, when possible. Acute kidney injury requiring dialysis has occurred with the use of GBCAs in patients with chronically reduced renal function. The risk of acute kidney injury may increase with increasing dose of the contrast agent. Extravasation and injection site reactions can occur with administration of VUA. Ensure catheter and venous patency before the injection of VUA. VUA may impair the visualization of lesions seen on non-contrast MRI. Therefore, caution should be exercised when VUA MRI scans are interpreted without a companion non-contrast MRI scan. The most common adverse reactions, incidence of greater than or equal to 0.5%, are injection site pain, 0.7%, and headache, 0.7%. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please click here for full prescribing information for VUA, Gadopiclenol, solution for injection, including boxed warning on nephrogenic systemic fibrosis. Manufactured for Bracco Diagnostics, Inc. by Leibel Flarsheim Company, LLC. Raleigh, North Carolina, USA 27616. VUA is a registered trademark of Bracco Imaging, SVA. Bracco Diagnostics, Inc., 259 Prospect Plains Road, Building H, Monroe Township, New Jersey, 08831, USA. Phone 609-514-2200. Toll free 1-877-272-2269, U.S. only. Fax 609-514-2446. Copyright 2024, Bracco Diagnostics, Inc., all rights reserved.